Hello and welcome again to the In Vivo Imaging with Success Knowledge Sharing Video Forum. I'm Dr. Alexandra Delille and Director of Technical Applications at PerkinElmer. Today we will discuss the basics of in vivo optical imaging in two short videos. This video covers part 2, Kinetics in Animals. If you have questions and want to explore further, feel free to email me at alexandra.delille@perkinelmer.com. Know the kinetics of your model. Once you have determined your reporter of choice, it is important to run a pilot study to determine the kinetics of your substrate or imaging agent. D-luciferin is the substrate for firefly and click beetle luciferase. In the left panel, Dr. Burgess et al. Grafted the luciferase-expressing glioma cell line orthotopically in the brain, as well as heterotopically in the flank of the mouse. D-luciferin is not metabolized. It is a small molecule that freely moves across the cell membrane in a concentration-driven influx and efflux pattern, and it is eliminated from circulation by the kidneys. Upon intraperitoneal injection, D-luciferin is slowly absorbed into circulation and perfuses tissues and cells. Influx is more rapidly than efflux, and it is important to determine the peak and plateau phase time points post-injection, as these are the optimal time points for imaging. Upon intraperitoneal delivery, signal will be eliminated 3 to 4 hours post-injection. Determining kinetics is also important for fluorescent imaging agents, as signal will be abundant and omnipresent upon intravenous injection. A wash-in, wash-out effect is observed, and we want to determine the time point where the imaging agent is bound to its target and the free dye is eliminated. This time point can fluctuate, often between 2 to 48 hours. Again, it is also important to determine when all the dye is eliminated from the mouse in order to prevent amplification of signal due to accumulation with repeat imaging. What is the recommended dose for D-luciferin? 95% of the publications advocate 150 mg per kilogram upon IP injection. Increasing dose increases signal, but not exponentially. Even with 300 mg per kilogram, we do not reach saturation. For bright signals, you may be able to use a lower dose. For low signals, one may increase the dose to 300 mg per kilogram. The rule of thumb is to stick with the same dose and same route of delivery within a study. I also like to stick with the same batch of D-luciferin. Keep D-luciferin on ice under foil and toss at the end of the day. Comparison of D-luciferin kinetics IP versus IV. Again, 95% of publications advocate intraperitoneal delivery. The top graph illustrates the fast kinetics of intravenous bolus delivery. Signal is up to 9-fold stronger upon IV injection, but returns to baseline within a couple of minutes. From a practical point of view, IP injections are easier while providing sufficient sensitivity, and it's therefore the preferred method. In certain cases, subcutaneous delivery in the scruff of the neck have proven advantageous over IP injections. Please see the excellent reference on this subject by Dr. Abdel Wahab et al., published at Jove. Brighter cells offer improved sensitivity. The higher the photon flux of the cell line, the earlier we can detect the cells in vivo. Good laboratory practice is to verify the photon flux of the cells in vitro in a black polystyrene clear bottom well plate in the IVIS. Serially dilute the cells, add D-luciferin at 150 micrograms per ml, and image the cells. Draw regions of interest around the wells and calculate the photons per second per cell. We'd like to see at least 100 photons per second per cell, but the 41 Luke2 cell line illustrated here is at 7,000 photons per second per cell, therefore allowing us a sensitivity of just a couple of cells subcutaneously in an animal. This is powerful as it allows the detection of tumor 3 weeks prior to caliper detection, opening the opportunity to assess tumor growth in the early exponential growth phase. Use hairless white or depilated animals. Besides electing the reporter with the highest sensitivity for your research model, it is also important to determine the best animal for optical imaging. Since the pigment blank absorbs light significantly, one will preferentially use hairless, white, or depilated animals. The C57 Black 6 mouse is a very popular strain, and fortunately to us, in vivo optical imagers, there is a syngeneic albino strain commercially available through various vendors as illustrated above. The animal on the right was topically shaved to allow the detection of a brain tumor. The animal on the left was not shaved and shows light detection in the paws in an arthritis model. My concern with dark animals is that one may unintentionally mask signal in the furry parts of the animal. Therefore, you may consider using Nair, we like the sensitive skin variant, to depilate or shave the mice. Make sure to continue this practice throughout the study. Once you have elected a reporter and animal, it is important to determine the necessary control groups. With bioluminescence, we strongly recommend to take a time-zero image of the subject with and without D-luciferin. Not only does this eliminate potentially contaminated animals, such as contamination with bioluminescent bacteria or radioisotopes or dirty bedding phosphorescence, but it will also allow you to measure the basal level of autoluminescence in your ROI, facilitating longitudinal measurements of increase or decrease of photon flux over time, as animals do not exhibit an absolute zero. For transgenic mice, we like to include a non-transgenic negative control. For fluorescence, the minimum is to include a blank negative control and a non-targeted dye, for example an IgG-labeled antibody or free non-reactive dye, versus the targeted imaging agent. A block target may also be of interest to validate specificity. Ideally, the target will also express, for example, luciferase to again validate specificity. Keep animals warm, have a consistent anesthesia procedure. Anesthesia and body temperature affect metabolism and may alter kinetics. Keep animals warm and be consistent with your anesthesia procedures. Always inject at the same time point. Animal positioning and shielding. As tissue absorbs and scatters light, positioning does affect sensitivity. Always position your animal with a light source perpendicular to the camera. Image multiple sides or use a side view mirror accessory which provides 2 additional views in one image acquisition. For bright light sources, it is recommended to place guards in between subjects to prevent reflection from one animal to its neighbor. These guards fit nicely into slots in the anesthesia manifold. Additional shields can also be used to cover primary tumors. Masking the primary tumor allows to increase acquisition time to detect small metastatic lesions without risking to saturate the CCD. In this case, the primary tumor was strategically inoculated in the inguinal mammary fat pad, away from organs of metastases such as liver, lung, brain, and lymph nodes. Here again, the tumor was inoculated remote from metastatic sites. In the lower panel, the primary tumor was resected at about 200 cubic millimeters in order to study metastases post-resection, mimicking the clinic. After your last in vivo image, sacrifice the animal and necropsy tissues and organs. These can quickly be imaged in the IVIS in a quantitative manner and are therefore a fast and effective validation method, especially of imaging in 2D where we do not have depth assessment of the source. I would like to end this presentation with an excerpt of a Joe video from the laboratory of Dr. Godwin, illustrating standard bioluminescence imaging procedures in an ovarian cancer model.
Here, the IVIS spectrum imaging system is used to monitor the behavior of cells injected into the intrabursal cavity. Experiments using this system typically have a time frame of 4 to 16 weeks from the time of tumor implantation. Load the luciferin solution into a syringe with an attached 30-gauge needle. Verify the depth of anesthesia of an isoflurane anesthetized mouse by toe pinch. Then, deliver 200 microliters of prepared luciferin solution via IP injection. Then, place the luciferin-injected animal back into the induction chamber. Record the time of injection in order to keep the time consistent between luciferin injection and imaging performance throughout the study. Place the anesthetized animal dorsal or ventral side up on the imaging stage. Position the animal's nose in a nose cone to maintain proper anesthesia induction. Make sure the animal is within the point of interest grid as indicated by green illumination. Set the imaging system to the appropriate settings. Be sure to initialize the system before acquiring the first animal image. Close the door of the imaging chamber. At the appropriate time, acquire the image. Remove the animal from the imaging chamber and place it back into its cage. Monitor the animal's recovery as before. OVCAR5 cells expressing luciferase were injected intrabursally into the right ovary of a mouse and in vivo imaging was performed. Images were taken 13, 17, and 22 days after the injection using the IVIS spectrum imaging system. The dorsal side is shown in the upper panel and the ventral side is in the lower panel. Note the peritoneal spread of tumor cells 22 days following injection. Injection of luciferase-expressing cells and in vivo imaging technology allow for a non-invasive means of tracking tumor growth and distribution in individual animals.
Human cancer and response to therapy is better represented in an orthotopic animal model. The techniques presented here are useful in understanding the development and spread of ovarian cancer and in assessing novel therapeutic regimens that may ultimately improve the outcome of patients with this deadly disease.
In summary, choose reporters that excite and emit beyond 600 nanometers. Use hairless, white, shaved or depilated animals. Switch to autofluorescence-free mouse diet. Run a pilot study to determine kinetics. Image at time 0. Determine appropriate control animals. Image at the same time point post-substrate injection. Image in the views that yield the highest signal intensity. Keep animals warm, be consistent with anesthesia methods. Image tissue and organs ex vivo for validation. Use Blackwell plates for in vitro imaging. Thanks for viewing this knowledge sharing presentation. Stay tuned for more videos. If you have questions, feel free to contact me by email at alexandra.delille@perkinelmer.com.